Hello everyone, my name is Eobe Gloria Besim, a nursing student and the holder of the HND diploma. You all are welcome again to this YouTube channel. Last session we began talking on pediatric pathologies and we spoke on pneumonia as one of the most common pediatric pathologies. Today we are going to be dealing with diarrhea. As we all know, diarrhea is a disease that affects both children and even adults. In fact, it affects everyone. But we are going to be talking about diarrhea and how to manage it in pediatric patients. Before we begin this video, I want to acknowledge my mentor, Mr. Ben Conrad, who has given me the opportunity to be able to give this presentation and also to be able to present the PowerPoint. So now let's get to it. Our presentation outline is going to be running from definition to conclusion, where we are going to be talking on the definition, the pathophysiology, the causes, the risk factors, the signs and symptoms of diarrhea, the diagnosis, the treatment, the nursing intervention / management, prevention, and of course, we are going to conclude for this lesson. As we all know, when an individual goes to the toilet more frequently than usual in a day, they are often referred to have diarrhea. So what is diarrhea? Diarrhea is the passage of loose stool 3 or more times in a day, and it can be caused due to irritation in the bowel. Now for the pathology, the pathophysiology of diarrhea. Diarrhea can be caused due to the imbalance of the absorption or secretions of fluid in the intestines, and it can be caused by 3 main reasons. First, when food moves too quickly through the digestive tract, it can cause you to pass out so frequently. Secondly, malabsorption of fluids and nutrients from the food that has been ingested can also cause the stool to be passed out frequently, and that's what causes the stool to be watery and loose. Thirdly, oversecretion of fluids due to irritation of the intestine, and which is usually due to infection. Mentioning infection, let us move to the causes of diarrhea. Diarrhea can be caused by 2 main agents, infective and non-infective agents. Infectious and non-infectious agents. For the infectious agents, we have bacteria, we have virus, and we have parasites. An example of a bacteria that can cause diarrhea is the most common bacteria we all know, E. coli or Escherichia coli. For the viruses, we have as example rotavirus, which can be prevented by vaccines, and we also have parasite. Example of a parasite, Giardia lamblia. For non-infectious agents, we have ingestion of bad water. We also have medications. We have disease conditions like irritable bowel disease and Crohn's disease also. We also have food intolerance, especially for those who are lactose intolerant. Moving to the risk factors of this disease. As we all know, most of the risk factor that we know that could be a predisposing agent to this disease is bad hygiene. Poor hygiene and sanitation can cause us to have diarrhea. Bad water can also cause us to have diarrhea. Overcrowding in our area can cause us to have diarrhea. We also have age, as it is more prevalent in younger ones than in older ones. And we have loss of breastfeeding. Research has shown that children who are breastfed well or which undergo exclusive breastfeeding are less prone to have diarrhea than children who have not. Now let us talk about the signs and symptoms of this disease. The first sign and symptom of this disease is frequent loose stool, passage of frequent loose or watery stool. Of course, this is one of the most indicative signs and symptoms of this disease, followed by abdominal pain or abdominal cramping. We also have fatigue, dizziness due to too much loss of fluid and electrolytes. We have loss of appetite and we have dehydration. For the diagnosis of this disease, the diagnosis is not really complicated, as most of us will already figure out that passes of loose stool already signify diarrhea. But it is also important to diagnose this condition properly, as to be able to know the proper treatment to be given to the child. For the diagnosis, we have physical examination, where we are going to be examining the dehydration status of the child, the skin sugar of the child, and taking down notes on the signs and symptoms. We're also going to be having history to know for how long the symptoms have persisted. Stool tests can also be carried out to identify the microorganism found in stool for proper treatment. Blood tests can also be carried out, and urine tests can also be carried out. Now, for the treatment of this disease, there are four main treatments that can be given to this child, and every other treatment can be added based on of the physician. The first treatment that is always advised to give the child is oral rehydration solution, also known as ORS, and it can also be made at home. Also, the physician might prescribe antimicrobials, which will help to fight against microbes in the intestine, which cause irritation. Also, anti-diarrhea medications can be given to stop the passage of the stool, the watery stools, and to help retain the fluids. And IV fluids are given to reduce the level of dehydration. Now, as seen in the image below, ORS can be made at home by putting 6 teaspoons of sugar in 1 liter of water and half spoon of salt. Some people may decide to put half lime while other people don't. It's the same thing. Now, what is the mechanism, or how efficient is ORS? ORS is very efficient as it will help reduce dehydration by retaining fluid in the body and reducing the passage of loose stool. Because ORS has the ability of glucose, it has the ability of glucose to stimulate sodium and fluid absorption in the small intestine, reason why it is very efficient for the treatment of diarrhea. Moving to the nursing intervention and management of ORS. First of all, the first intervention will be to monitor the child's vital sign, to record the child's dehydration status, to note the skin sugar of the child, to note the temperature, to record the frequency of stool passage. Secondly, we are going to secure an IV line so as to be able to send IV fluids to reduce dehydration or to hydrate the child and maintain electrolyte balance in the body. Next, we are going to be carrying out dietary management, as this is a very important role in children, in pediatric children suffering from diarrhea, as it will help them to regain their energy. Now, sources of food that can be given to these children to maintain their energy, we have food like banana, food rich in fiber, food rich in carbohydrate. The next, we are going to be monitoring the child's recovery and dehydration state. After passing the medications and putting the IV fluids, you're going to be recording if this child is getting hydrated enough and this child is getting better or not. And next, we are going to be educating the caregivers on the conditions, the causes of the condition, how to handle the condition before bringing the child to the hospital, when to bring the child to the hospital, and so on. Last but not the least, we are going to be talking on the prevention of diarrhea. Prevention of diarrhea, already the first and the most important, is to maintain a good hygiene and sanitation, to maintain a good environment for the child, an environment free of microbes. We know that we cannot be 100% free of microbes, but we should minimize these microorganisms in our environment, in the immediate environment of the child. Next is vaccination. There is a vaccine for rotavirus which will help to prevent this kind of disease, diarrhea. Next, we are going to be talking about safe drinking water. If the caregivers live in an area where they can't have potable water or water that is suitable enough for drinking, they could use the various methods of sterilizing water: filtration, boiling, chlorination, and so on. So we're just going to educate the caregivers on this aspect. Next, we have exclusive breastfeeding. Exclusive breastfeeding is very, very important, as it shows that these children will need to be exclusively breastfed so as to gain all the antibodies they need to fight against infections in their body. In conclusion, diarrhea, like any other disease condition, should be given proper attention as this disease may lead to other complications in the child. I hope you all enjoyed this video, and I hope that you guys learned or picked at least something new from this video. As usual, this video is open to any corrections, any contributions, and thank you for your time. I wish to acknowledge again my mentor, Mr. Ben Conrad, for the opportunity. Thank you guys very much for watching this video. See you in the next session.